This is why the Medicare Advantage scam will be difficult but very important to solve. The Medicare Advantage facade is beautiful. So I had two people right away contact me, right? About how they're happy with their Medicare Advantage. And I get it. I honestly get it. For you right now, it is working perfectly. The Medicare Advantage facade is beautiful, but the destruction it progressively causes to healthcare for the elderly and disabled will be realized when it is too late if we do not stop it now. And what I said in the article, let's see. Bruce Pollard said, in any balanced system, healthy people pay more than their share. Exactly. Yesterday, the co-founder and president of One Payer States, Chuck Benacchio, appeared on Politics Done Right to discuss the different methods of destruction of Medicare Advantage and ACO with Medicare Advantage and ACO REACH. Those programs are nothing more than taxpayer health transfer conduits. The problem is that these programs are very well advertised. They also use many gimmicks to get people to sign up. Worse, it works well for a select few who do not bump up against their hidden pitfalls. One must remember, these entities are created to make money primarily. You are just a pawn in the system. You are just, that's not what I said. You are just raw material for them to get there. To maximize their profits, your services must be cut or they must rip off the government as they are doing right now. I received an email from a dear friend who listened to the tail end of the program. She is having a great experience with Medicare Advantage, and it is definitely costing her less, and her services are excellent. Please email me your experiences. I'm asking you all who have experiences. Please email me your experiences at info@politicsdoneright.com. info@politicsdoneright.com. If I use your email on a program, I always protect your identity by removing your name or any information that may identify you. Here is her redacted email. And I want to read this email because it is important to understand why it's going to be difficult. It's a difficult fight. And for all the Medicare, for all warriors on here, we have to understand the psyche of the people that we have to convince. They want Medicare Advantage, but they don't want to lose what is currently good for them. So we have to make sure that when we are offering an alternative, that it's right. But anyway, here it goes. This is what she wrote to me. She says, "Hope you're well. Thank you in advance for listening to my rant. I only caught part of your program and maybe I missed a good argument, but I'm not impressed with Chuck's indictment of Medicare Advantage. As you know, Medicare does not cover much by itself and everyone needs a Medigap or Advantage plan. For me, a decent Medigap plan would be several hundred a month, which would not include prescription drug coverage. My United Health plan is $10 a month and I can see any doctor who takes Medicare for a slightly higher copay. My primary care doctor has no copay, nor do telehealth visits with my primary specialist or urgent care doctor. In other words, you don't have to pay for that. I have a lot of elderly person issues with my spine and have been getting shots by a pain specialist under a fluoroscope. Cost is $35. I've had 7 MRIs in 6 months for $875 total. The doctor's network is really good, not just the Shockley ones who need patients, but folks from Mount Sinai and Columbia and Northwell Health. I also get free dental checkups and cleanings. I did 4 months of PT for $10 a session. I really can't complain." All right. The commercials are obnoxious, but I think depending on your area, the company, and most importantly, the participating doctors and hospitals, you can't beat it. That's her impression of Medicare Advantage so far. I agree with the problem of corporate greed and the need for a single payer system. So she agrees with that, but she needs to know that it's going to serve her well as well. But I would hate for someone like Chuck to dissuade someone from talking to a reputable licensed agent and evaluating their options in a rational way. I believe Chuck said something to the effect that plans get you in with all their hype, but you can't get care when you need it. That simply isn't true. That isn't true for her. Yes, the system is sick, but for many seniors living in the here and now, Medicare Advantage is a great option. In other words, and she makes sense. She says, look, we know we need a lot of changes, but for those of us who have to live today, we have to take the best options we have. I get it. But in as much as you have to take the best option that you have, we need you. We need you. If you must take the Medicare Advantage, still help us fight for Medicare for all, for healthcare for all, for a single payer system so that it'll help everybody. Because right now, Medicare is unsustainable. Let me give you my answer and then we will continue. It goes like this. The great experience that my friend is getting cannot be discounted. She is absolutely right. Note also, she also acknowledges that a single payer system is the only economical answer. I replied as follows. Great hearing from you, sis. Please give my regards to hubby. You have a great deal with great doctors and great perks. For your individual case, your advantage made sense and cost you a lot less and was the most prudent thing to do. Now, here is Chuck and my beef. It is not sustainable. The reason there is Medicare is that the private sector would have to charge too much to include older people who get sick in their plans. So they offloaded it to government, who have a nonprofit system with a 2% overhead in administration. It is generally the standard 80-20 plan without dental, eyes, or hearing. Medigap covers your 20%, but it is expensive relative to your Medicare Advantage. The way Medicare Advantage works on the inside is to overcharge the government for each subscriber by a bunch. And that is why many of them are under indictment. Many of them are getting fined. That's just the business model, as Bernie would say, is fraud. They make money from the overcharge and by denying coverage where possible. In your case, they are likely still fairly profitable on the overcharging portion so that they do not deny too much for you. All those extra billions are going into the pockets of the shareholders and executives. It costs the entire Medicare system more to allow those parasites to make money on our illnesses. Medicare Advantage uses the perks, dental, hearing, eye coverage as selling points while buying politicians to forbid Standard Medicare from offering those services. The government could allow you to get those services, meaning dental, eyes, ears, at a less expensive cost, less expensive than Medicare Advantage. But they don't want that offered because they don't want a low-cost competitor to what they have to sell to make money for their investors and their executives and their shareholders. You can't pay executives billions, shareholders billions, have multiple advertising expenses, database costs, real estate costs, and all these other expenses insurance companies have, and somehow be less expensive than a single payer Medicare system. You can't. It's mathematically impossible. Medicare Advantage transfers our Medicare tax dollars to parasitic executives that really are just middlemen that provide no improved health outcome. Look, my friend, these guys are savvy with the ripoff. They give the semblance of having a good product. Now here's the kicker to tie everyone to Medicare Advantage. When you first get Standard Medicare, if you purchase Medigap, then you cannot be denied, nor can they charge you more based on health testing or your health condition. However, if you are on Medicare Advantage and your insurance company refuses to cover something, Standard Medicare will. If you try to go back, the Medigap will health test you and can charge you anything for that Medigap. So if you don't take it up front, if you don't stick with Medicare and you go with Medicare Advantage and then Medicare Advantage screws you, coming back is next to impossible. I understand the attraction to Medicare Advantage. These guys are master salespeople. If they continue their success, they will continue to deplete the Medicare coffers, and we will be left with private health insurance at the behest of parasitic profiteers. This year, they are at already 50% of the elderly. Look, Ashley and Linda are fine because she asked about Ashley and Linda. Ashley is recovering slowly. It is still difficult for me to see how much she had to go through. And it cemented in me how evil our healthcare system is. It is an inhumane, money-making enterprise. I will be fighting till I die to try to do my part to make things better for most. It starts by relying or by telling the truth and breaking down the facade. It is so important. It is absolutely so important to break the facade. Medicare Advantage is killing the Medicare budget by taking out more per person than Medicare proper. If we took it all into Medicare, we could be a lot more economical. We could provide ears, nose, and eyes to everybody at a much cheaper cost. But you know why we don't? Because the Medicare Advantage guys have found yet another way to pilfer the government, fool the American people into giving them currently a good product, but it's all smoke and mirrors. It's a sham that ultimately will come crashing down. There's no two ways about it. And again, folks, anybody wants to tell me their Medicare stories, please feel free to send it to info@politicsdoneright.com. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.